6 minutes past the hour. Dr. Karen is in studio already, get ready to take us through the conversation of the day on menopause. And believe it or not, I have seen a question already. But before we get to your questions, I would love to let every other person who has not sent in their question know that this is a chance for you to ask as many questions as you can regarding the topic of today, that is menopause, and any other question to do with your reproductive health as a woman, that will be answered here. And today 20933 is our SMS line, 0717 400 555 is our WhatsApp number, and of course you can also get us at Hope FM Live across social media. Just before I bring in Dr. Karen, allow me to invite every man to this amazing meeting that is going to be taking place this Saturday at Sitam Karen. It's a prayer meeting. Yes, men ought to pray and not faint. That is what scripture says. Well, may not have been referring to only men in the sense of male, but yes, this is an opportunity for all men to gather for a time of prayer, 8 a.m. to 1 p.m. this Saturday at Sitam Karen. The theme is Declaring His Glory, drawn from 1 Chronicles 16:23 to 26. And the speaker will be Reverend Jesse Mwai. And you also may want to note that this prayer meeting will be live on Hope TV, and all are welcome. Dr. Karen, good morning.
Good morning, Sharon. How are you?
I'm fine, thank you. It's
nice to see you.
Nice to see you after a while.
It's been a bit of a minute.
Yeah.
Yes.
But I'm happy to see you, and I'm glad you're well.
Thank you. Thank you. I'm
And
doing well.
Thank you. And we're looking forward to today's conversation.
Me too.
I don't know where we start. Menopause. Menopause. What is menopause?
Thank you, Sharon, for this very important topic. Menopause is that thing that's not really talked about. Not everybody talks about menopause.
Right.
And not everyone knows what menopause is. But at least most women really kind of know that at the end of, like when you're heading towards a certain age, there's something that will change. So menopause is a part of life. It's a change that occurs in women when they're going towards their end of their reproductive age. From the age of 40 and above, there's a time they will lose their period. And that is usually the sign of menopause. How do we know someone is in menopause? Is if they've not had their period for more than 12 months. That's after that, you're able to know that you have menopause. You don't need to go to a hospital or a doctor. It is self-diagnosable.
Okay.
Yes.
So 12 months straight, like concurrently, yes. Like month 1, month 2, 12.
Yes.
Okay.
Yes. Usually there are stages of this menopause. But when you know that you've really gotten into it is when you don't have your period for around 12, not around, exactly more than 12 months.
Okay.
So once you're on your 12th month and you've not had your period, then you know for sure you're in menopause. Yeah, but there are stages. What it means is it's really a rite of passage. It's sorry, not a rite of passage, but a stage of like puberty, when you go into teenagehood,
yeah.
And then become now a reproductive age patient or mother or lady. And then after that, there's that part where you stop being reproductive. And that's now when we say it's menopause, only marked by the 12 months of no period.
Okay.
Yeah.
All right. So when you say there are stages, what are we looking at? What are we talking about?
Okay. So there are 3 stages of menopause. So usually from when you're above the age of 40, most people will start around that time. From 45, the average age is around 45, 50.
Yeah.
So when you're around that age, there's a part where you start having a few things that will change. Your period starts to become little. It might start as a lot of period, like 1 month is heavy, and then after that it reduces. So you have like little every month, or they become irregular, and then you have a few changes in your body, and then so it takes around 1 or 2 years, and then you get into now it's called perimenopause. Then you get into now that one where your period now disappears, and once it disappears for 12 months, it becomes menopause. and menopause can last even around 4 years on average. So it's a period of time. It's actually a long period of time. Then after those 4 years on average for most people, everything else will go back to normal. So you, apart from your period, so you're back to your usual self, and you have no period, but now you're basically okay. It's called postmenopause. So there's perimenopausal, which is just before your periods disappear. There's some changes. Then there's menopause, when your periods disappear for 12 months, and then postmenopause after the 4 years of transition. Yeah.
Okay, so what changes are we talking about when we say changes? You say peri?
Perimenopause.
Yes, perimenopause. So
Yes.
what are some of these things we begin to see?
Yeah, women, when you're in your reproductive age, you have periods. You have, your breasts are fuller, and then you have there's the effects of estrogen, which helps you to be who you are. But when you're going into menopause, your estrogen goes down. It goes down significantly in a way that the actions of this estrogen disappears. So things like you start getting a bit moody, because the hormones keep you somewhat balanced. So there's a bit of mood swings. You can have forgetfulness very easily. Then you have your body changing in terms of, now it's even harder to lose weight. Sometimes you lose fat in those places where you don't want to lose fat, like your breast tissue. They kind of like shrivel a bit, and then you also have your periods disappearing completely. Then you have these hot flashes. Hot flashes are characterized by a few minutes, like 1 to 2 minutes of some heat flash that goes all the way up to your neck and your head, and feels very, very irritating. So those hot flashes are kind of like the mark signs for most women.
Yeah.
You had hot flashes, so you're going to menopause. And then you have some changes in your urine, how you pass urine sometimes can be painful. There could be dryness down there. There could be itchiness down there. So it's very, very uncomfortable symptoms that occur. But these are not disease. It's not a disease on its own. It's just those changes that occur just before your period completely disappears. Yeah.
Okay, so I heard you say that there is a post menopause. That means you get back to normal. I think that is what I had you say.
Yes, you go back. Now, all these symptoms that have been occurring before
Mhm.
tend to reduce
Okay.
after that period, the 4 year period, which is the average of most people. Some will be less, some will be a bit more. After that, then they have this resolution of those symptoms. So it makes you feel a bit better. You're less moody, you're less forgetful. The dryness also kind of reduces a bit, because that 4 year period is very tough for most women. In fact, some people even go into depression and anxiety. And for some, when it's very, very severe, they have to go to the doctor, come back to us so that we can be able to help them treat these menopausal symptoms. So yes, postmenopause is literally you're done with this. It's a very, very tough period of time.
Okay.
Yeah.
So what exactly? Okay, I'm not looking at this for scientific names, but
Yes.
I'm wondering, in layman's terms, what exactly is happening in a woman's body when they are in menopause?
Okay,
Yeah.
okay. That's a very important question, because most people really want to understand what's going on in them. And I'll reiterate again, this is not a disease. It's just a state or a
Yeah.
transition point to another stage in life. So what happens when you're normal? Maybe I should start there. I always talk about estrogen, progesterone,
Yes.
and something called follicular stimulating hormone. Some may understand it because some of the tests we do those kind of hormones. So when you're within that reproductive age, there's no all of them are normal. When you're in menopause, it's very normal to be in menopause.
Yeah.
So when you're in your reproductive age, you have a balance between your estrogen, progesterone, because you're producing an egg every month. But now you're not producing an egg, because the egg reserve has gone down, and you don't have ovulation anymore in menopause. So when you're producing an egg, you produce when the egg comes out, whatever remains, because it's called a corpus luteum, it produces progesterone, and it also produces estrogen.
Estrogen.
It also contains some estrogen factor.
Okay.
So this estrogen is what we really want to concentrate on. Estrogen in your body helps you to maintain, the fat areas that are supposed to be there in the breast, in the hips, maintains your bone structure, heaviness, the structure of being strong and all that. And then it helps you maintain your moods and all that. So what happens is that in menopause, when you don't ovulate, you don't produce that corpus luteum to produce the progesterone or estrogen. So estrogen levels have decline. They tend to decline. And there's a way estrogen works together with also another hormone called follicular stimulating hormone, which they balance each other. So when estrogen goes down, follicular stimulating hormone goes up.
Okay.
So this estrogen, when it goes down, that FSH, when it goes up, there are now these changes that occur because of the reduction in estrogen in your body. So what happens is that estrogen helps you maintain the same things, the moods, the bone density. So you'll find someone who's in menopause can fracture easily because when estrogen is down, you're also likely to get osteoporosis, and then you can easily break a bone. Estrogen also helps you keep not prevent dryness down there. So if you don't have estrogen, you have now a problem down there. It becomes itchy, becomes irritable. You cannot be able to have intercourse properly, and then you have lower libido at this point. So there are many things that estrogen is important in our reproductive age, because you need to have the hamu to be able to reproduce as well. So in menopause, the estrogen is down. So that is the main thing that happens. And in fact, when we test people, sometimes we can't say that one hormone we will test one hormone and say you're in menopause, but that FSH, the one I talked about, and the estrogen level can actually tell us you're actually going into menopause, or you're already in menopause.
Okay.
Yeah.
So apart from the lack of period for a period of 12 months, which you mentioned, um, is there any other should I call it symptom? I don't know what to call it because it's not a disease.
Yes.
Is there any other thing that indicates? You say you talked about a test
Yes.
that you do.
Yes.
At what point does one need a test? Like, okay, let me put it this way. I am in my 40s and I am seeing this and this and that, but I don't know if exactly this is
whether you're in menopause.
Yeah. So how do we rule out? How do we decide?
Yeah.
Apart from the 12 months, let's say I've not gone through the 12 months.
Yeah.
So how do we know?
Yeah. I think that's because I've had a patient who's come to me to ask me, can I continue with this contraceptive because I don't know whether I'm in menopause or not, but I feel like I have symptoms, or maybe you don't have symptoms at all, but you're missing your period for the last 2-3 months. Such patients, now you're not very sure, and obviously because of very good reasons, you want to know whether you're still fertile or not, and whether you should continue with certain contraceptives that maybe you're on a coil, and you want to know that when I remove it, am I safe or not? It is possible to be able to test a patient, but first you look at all these factors. First of all, your age. How old were you when you started your period? There are many factors we look at before we can say for sure you're getting into menopause. We look at even whether you are taking, because smokers tend to go into menopause earlier, actually even up to 2 years earlier. If you take alcohol, if your diet is this way, if you're obese, if you're underweight, your age particularly kind of tells us that you're actually going into menopause. So all those factors in terms of your history can tell us, okay, we might be going to menopause. The other thing is the symptoms. If you have any of those symptoms, especially the common one is the hot flashes before you even get your periods going away, that can also be a sign that you're in perimenopause. You're going into menopause. So most people will be able to diagnose themselves as menopause because they know once the periods are gone, that's it. That's it. And most women, even in the olden days, in our forefathers, they knew by the time I'm missing periods for a full year, this is not coming back. They'll do, hiyo niliacha kitambo, So they doesn't need diagnosis from a doctor. Most of the time it's self-diagnosis. Because they didn't have the 12-month period. But you can be able to tell from even that irregular periods you're getting, or even just a bit of heavy menses, and then after heavy menses, it starts to become irregular. that can be also one of the signs. And then after that, we can test you. We can test your FSH levels and find out whether these levels are high enough to say that there's no enough estrogen to balance the two. Okay, so that high FSH is also one of the signs, but on its own we just can't say that
Yeah.
you're in menopause. Yeah, for such people we usually recommend that just take it easy, just let it, you don't have to confirm anything, unless, if you want to use a contraceptive, we actually encourage them to still continue using whatever they're using until they get the 12-month amenorrhea. We call it amenorrhea, lack of period.
Okay.
Because even when you're having your irregular periods, can you imagine you can get pregnant? Because you're still ovulating. For you to have a period, you're still ovulating. So if you are ovulating, then you're going to have a period. If you're going into menopause and you're having a bit of a period here, and it means you're probably ovulating at some point, and we can't tell at which point. So we still encourage them to keep that contraceptive a little longer, or if they need to change it, they use another one. It doesn't have to be a hormonal one to prevent pregnancy during this time. There are babies who are born to perimenopausal women, like, oops, what, at 49?
Yeah.
We do have that as well.
Okay.
Yeah, so it's a combination of many things that help us know that this is menopause.
Okay.
Yeah.
Okay.
Yeah.
I think key for me is it's not a disease. So
It's not a
we wouldn't
disease.
say there is a treatment for it.
Okay. It depends, eh?
Okay.
It depends.
Okay.
So, why we discuss menopause at length now, it's because of the kind of effects it's giving to many women. Because we are at a society, as I said, we are taking a lot of things. We are taking a lot of the diet is not perfect.
Yeah.
We don't have people are smoking, especially now women. A lot of women are smoking. We have very adverse effects of this very low estrogen. So for example, if you have hot flashes, that thing is very uncomfortable. Hot flashes are like, can you imagine just feeling like as if warm water or heat is just coming up your neck? It literally travels up your neck, going up to your head, and you feel agitated. You're not okay.
Does it come with sweating or it's just a
Yeah,
flash?
for a full 4 minutes, we can be sitting here, and maybe I'm the one going through menopause, and I'm sweating, and you guys are okay. And you'd ask me, "What's wrong? Are you okay, Daktari?" But I'll be like, you know what's going on, but you can't really tell everybody I'm going through menopause, because there's also this stigma of going. I don't know why there's stigma about menopause, but you can't explain, because you're heating up. And you don't want people to ask you because you're getting agitated. So these are the kind of things that, if the severity of you not being able to even have good conversations or good relations with people because of this irritability, the hot flash, it's not a very good feeling. They need treatment. There's also this symptom, like if you have osteoporosis, breaking a bone is not, it's very painful. You find it in elderly ladies. And then you're also at risk of getting cardiovascular conditions like heart disease and all that. So if the symptoms are very, very severe, like especially even pain passing urine can be very severe. The itching down there, the dryness can be absolutely horrific. So this kind of symptoms need to be treated, and that's why we say there's mild and severe. Mild you can manage, you can be able to do your normal activities, you can handle it for that day. But now when it goes into things like depression, anxiety, the dryness and the hot flashes is the main thing that brings women back to the hospital. We need to give them treatment, and because estrogen is the thing that has gone down, we can actually supplement this estrogen. It's called hormonal therapy, replacement therapy, where we do the estrogen, we give it to you, so that we can replace that estrogen that has, it's too low, so you're getting all those symptoms. It helps to relieve some of those symptoms, like for example, the itchiness, the dryness down there. You can give creams. We give estrogen creams to at least help with returning what was called normal. Because they're unable to really practice anything, especially with their partners. And you find now a lot of divorce, a lot of partner problems coming in at this point, because there's a lot of, it's a social thing. Yeah, so when it becomes very severe, we do need to include even other people like cardiac doctors, people who do hormones. We may involve endocrinologists as well to help us in managing this kind of patients, and also things like mental health. Psychiatrist or a psychologist, they come in very handy at this point. Yeah, so you can imagine what kind of things that go, and this is at the point where someone is, of course, they're going through menopause. They're going through, maybe this is the time when they're trying to settle their things like before they retire. So they have property, or maybe they are trying to look for money here and there. Maybe they're already divorced or separated. There's a lot of social things that go on around this time. So when it affects your life and it affects other people's lives around you, then you need to get help. And that's where we come in. Yeah.
Okay. Wow. Wow. Quite something.
Yeah.
Someone, okay, just before we get to the comments, Doc, I don't know if there's any other bit that we've not tackled when it comes to menopause.
I think that's mainly it, especially when it comes to the symptoms and when to know that it's a problem. When to know it's a problem is when you cannot do anything. It stops you from doing your normal activities. You feel you're going crazy. You feel everything in your body is just not okay. That's the time you need to look for help. If in case that it is just mild, then that's fine. So it's just that you need to know when to seek for help when it comes to menopause. And then for those ones who are like, menopause, I don't want to go through menopause, those ones need to know that it's not a disease. It's just part of a transition into something else later on.
All
Yeah.
right. Okay. So I'm just thinking it helps to know that every woman. I had a man earlier ask, "Do men go through menopause?"
We coined that term as andropause. They don't have cyclic changes like
Okay.
us.
Okay.
Them you know how they were created is that they, from the day they were born, they don't have eggs like us.
Yeah.
Us, we were born with eggs ready. Like that baby, the baby who's been born today already has the eggs to give birth later on in life. But men tend to form theirs every single day, every single day. They don't have that cyclic change
Yeah.
within themselves. But they go through things, because at some point when they're getting into that age as well, there are many things that occur in them. So they're not going through menopause, but we term it as andropause because they have a lot of other things going on within themselves, which men also don't talk about. In their 40s and 50s, midlife crisis, it is real. And it does happen. So it's not the same thing as women, but they have another name for their own.
Okay.
Yeah.
Okay. So I was just before I say that, I was about to say it helps to actually know that this will come at one point
Yeah.
in life.
Everyone.
So just get ready.
Yes,
for
yes. Right. And unfortunately, some people do get menopause earlier. Maybe I need
How
to mention
early?
that early, like some people who get conditions that lead them to menopause as early as even 30s, yeah, and 20s. So for example, those people who've had maybe problems with their ovaries, and then assuming that they had maybe even an ovarian cancer, because ovarian cancer has to be treated somehow. So most of these patients, we encourage them, if they're able to, even if they're early, very early, there are ways to be able to retain their fertility. But if the ovaries are not able to be, sometimes when we are treating cancers and all that, we can transplant the ovary into another part so that it's not in the way of the radiotherapy and your chemotherapy, so that we can retain your fertility.
Okay.
For those ones with ovarian cancer as well, there are ways we can be able to try and keep their eggs. That is to help them, because if we start treatment, there is something called primary ovarian failure. So if there's chemotherapy, if there's anything that goes into the kidney, to the every part of the body, it's going to affect the egg reserve. And women, we don't form new eggs. Those eggs were there, they're the ones which will be affected by these drugs. So they go into primary ovarian failure, and this can lead to early menopause. So they tend to form, the same symptoms, and they cannot be able to conceive because their periods will also disappear. There's also other people who have issues with just generally their hormonal profile, in a way that there's early it's still called primary ovarian failure, as long as it occurs before 40 years, then that's very early for menopause. Yeah. So it's unfortunate that sometimes these things happen even without us knowing, maybe because of family history. And then smoking, as I said, smoking is one of those things that lead to primary ovarian failure. People should be careful about that kind of substance use. It causes a lot of problems in our gynecological area.
Okay.
Yeah.
All right. All
Yeah.
right. Wow. Okay. Do you have a question, dear listener? 20933 is where you send it. That is 20933 on text 0717 400 555 on WhatsApp and at Hope FM Live across social media. Mary is laughing and saying, I think I am in this stage. She's saying, I think I just might be in the menopausal stage. Okay, Mary, let's see some of the questions that we have. Okay. Okay, so now this one asked the same question. I think we had asked that if men get to oppose.
Andropause, it exists.
Okay, so this one says I'm 43 now and still getting my periods. To which age does menopause start? But I don't use anything. I only do the 28-day count.
Okay.
Yeah.
It's the ages I gave were average age. So it can occur between the age of 40 to 45. That's the time you get perimenopause. But now menopause, it's remember there are stages. So you can be perimenopausal within the age of 40 to 45. Then between 45 and 50, that's when you go into at any one point at that point you go into menopause. So it's possible someone can have periods even up to 48 years of age until 50. That's when their period disappears. So everyone is different. So let her just wait, take it easy, just live life to the full.
Yeah.
This is not something that will stop your life.
Sure.
Yeah.
Okay, thank you. Hi, Doc. The hot flashes start during menopause, but when do they stop? How can I reduce the flashes that occur during the day because they are so uncomfortable?
Yes, these hot flashes are the main thing. And until you get to feel them, that's when you'll know how bad they can get. So these hot flashes occur it can occur anytime at perimenopause. During menopause, you might still experience the hot flashes, but after the menopause, now after the 12 months of no period, it eventually just tapers off. So it will go away, the hot flashes. But if it's very severe, we can actually manage them with hormonal replacement therapy. It's good to also note that as much as we want to give you this medication, and especially estrogen, estrogen is also very highly likely to give other conditions if we give a lot of it, because this is high dose estrogen. When you're trying to replace it, there are people who are at risk of getting, not because she's talked about it, I'm like, we try to reduce the usage of this estrogen particularly on the patients, because they are likely to, if they have a history of breast cancer, they are more likely to develop it faster. If they have a history of endometrial cancer, they can also develop this. So we are very, very careful on whom to give this HRT. It's called HRT. Things like thrombotic disease can also occur, like a DVT. You've heard of deep venous thrombosis, also very common with estrogen.
Yeah.
So unless it's very, very severe, that's when we do give other treatments. But we can also supplement with some supplements like vitamins, which will, like calcium, vitamin D helps to relieve a little bit of that feeling, and also other supplements which are usually herbal that we allow. All the supplements come from plants and all that. Yeah. So it's not just hormones that we give to patients like this, but we also give them other there's also in the house, you can use cool packs. Because when you know when it's coming, you can actually use home therapy, where you just keep a cold towel around you, or a cool pack, or anything from the fridge that helps you reduce this feeling. Yeah, so it's not the only way. I mean, medicine is not the only way to treat and manage, but it will be over soon.
Yeah.
Yeah.
Okay. Now this one says, I just wanted to ask, will menopause? Okay, ask, will menopause who's okay? Are the periods supposed to come? Because I have been having. I have been having periods. Okay. The the way it's structured gets it makes it difficult for me to read. Let
Mhm.
me try to see what they're saying. Okay, they seem to be talking about something you mentioned earlier,
Mhm.
whereby they miss their period sometimes, and
Yes.
then it comes, and then it goes, and then it
Yes,
comes. Yeah,
very, very common. It's
yeah.
expected that when you're above 40, between 40 to 45, you're going to experience some of these symptoms.
Hmm.
Some of them, it's just a sign that you're heading towards not the real menopause, because there's perimenopause, menopause, and postmenopausal. So if you're already at your 40, by the time you're at 40, our egg reserve has reduced. Yeah? So it ends anytime between 40 and 50. So before it ends, there's that time when you're ovulating, sometimes you're not. You're ovulating, sometimes you're not. You have irregular periods, you have a lot of heavy period, and then it reduces,
Hmm.
and then it goes away. Yeah, those are the stages that have to go on. But remember, not everybody will experience all these symptoms.
Okay.
Yeah, not everybody.
Ah.
Some might be lucky not to experience any of this. And especially if you keep a healthy lifestyle, reduce coffee intake. Oh, I love coffee myself. But I know, like, once you get there, you can also reduce, some of these things.
Yeah.
Coffee intake, exercise, eat healthier, preferably plant-based. I'm always that person who say, kind of, these guys eat plants,
Yeah.
eat a lot of plants liberally. So those things have a lot of antioxidants. You're able to manage yourself easily, and you will not necessarily go into menopause. Especially exercise, you'll help your mental health. Mental
Hmm.
health, your body will be fit. It will be ready to fight all these side effects of low estrogen.
Hmm.
Yeah.
Okay. This one asks, how do you okay, these hot flashes, doc. Oi.
They
How
are
do
bad.
we reduce hot flashes in menopause? Is there okay, that's one question. And then the second question, is there a way to reduce dryness down there?
Yeah, yeah. Those are the things that bring them. Bring any woman who has any issue
Yeah.
in menopause. Those two are the most common.
Mm-hmm.
So the hot flashes, both of them can be reduced by HRT, the hormone replacement therapy. But before you get there, there are those things I've talked about keeping cold packs, use a cold towel, shower. You can use a cold shower. Try and dress freely so that the effect is less on you.
Hmm.
So that would be really, really important. For the dryness down there, we can also use HRT, the hormone replacement therapy. We can give creams also to help with the return of the wetness, and then we encourage them to also use products that can increase that wetness, like you've heard of lube and all that. So it's all encompassing the estrogen level. So if that is not working, let them come to us. Then we'll be able to do a well controlled hormone therapy for them, especially those ones who are at high risk of developing some cancers.
Hmm.
Yeah.
Okay. I started menopause at 53. I am now 63. And my main problem, okay, is hot flashes. I can't sleep at night.
Yeah, it's
Oh,
let me tell you,
sorry.
if I can describe how these hot flashes are,
Yeah.
maybe even those ones who've had, there's some medication that even give you hot flashes. It's very, very irritating. It like it just gets on your nerves all over
Hmm.
and you feel it moving literally from the back to the back of the neck to the side to the ears, and just makes you feel
Everywhere.
like you're going crazy. And then the lack of sleep is one of
Hmm.
those other symptoms we didn't talk about. Lack of sleep is something, and lack of sleep leads to other problems in the body.
Hmm.
You're not concentrating at work. You're not able to do this. So the different ways of treating them is that.
Yeah.
But if it's causing that kind of lack of sleep, let us see you so that we can be able to do the mental, health check, and also the HRT.
Okay.
Yeah.
Thank you, Dr. Karen. Let's take the news at 12, then be back. 20933 is our SMS line, 0717 400 on WhatsApp. And please also get in touch with us through social media at Hope FM Live. We have news watch in just a few moments. Stay with us. Praise Junction at 14 minutes past noon. Good afternoon. Thank you for joining us on the 17th of November 2022. My name is Sharon Aitore, and you are on Praise Junction with me is Dr. Karen Muthembwa, helping us answer your questions, your gynecological questions. But we've been having a conversation on menopause. She has one more thing to say about that before we now get fully to answering your questions. By the way, thank you for all these questions. I don't know how much time we have, if we can answer all of them, but thank you. Dr. K.
Thank you. Thank you, Sharon. So I thought to make this, out there that even after you're done with menopause, like now you're post-menopausal, once you're done with all those things, does not mean that you run away from the gynecologist. We still need to see you. We still need to test for sexually transmitted infection. We still need to test for, check for breast cancer and these other things. For some, if you've never had a pap smear, it would be important to at least have one, at least in your life. So don't go away. You're not done with us. We are still here. We're supposed to see you throughout your reproductive years and even immediately after and during your transitions.
Okay.
Yes.
All right. Thank you. Now let's get to the questions. We start off with this one who says, what do I need to do to get ready to conceive at the age of 42? I have a 12-year-old son. I did not have any issue having him. It was a normal birth. What do I need to do to get ready? She's
Okay.
42.
Very nice question. I want to encourage her to go to her nearest gynecologist first. It's very good to actually prepare for pregnancy. And I'm happy she's asked that question, because Kenyans come to us when they're already pregnant, 20 weeks in, when it's starting to show. Everyone, just come before you get pregnant, because this year's 40 to 45 is when it could be perimenopause. That means you could be ovulating at any time, and it's possible to get pregnant. It's not impossible. And it's also, the chances also of also not getting pregnant is there. So we are here where we are not sure whether we are, or whether we are going to get pregnant. But as long as you're having your period every month, there's still a possibility of conceiving. As I said, even in menopause, it's possible to conceive. I mean, not menopause, just before menopause, when you're having this irregular period, you can conceive a menopause baby. We call them menopause baby. It's not a bad word. It's just, it is what it is.
Yeah.
Yes. But as she's preparing, she can start, even before seeing the doctor, she can start having healthier meals. So assuming she was already living healthy, just get a bit healthier. Get to the antioxidant things like plants and all that, vegetables, less fat and low, moderate carbohydrates, good protein quantities, and a lot of vitamins. Then she can improve her exercise levels. I'm talking to those ones. If you have been doing exercise, you can increase a little bit. If you have not been doing any exercise, then you need to get on a good, activity. Either skipping rope for 20 minutes, jump, what do you call it? Even jumping on the spot, or jogging on the spot, or taking a walk 20 minutes every single day. That will really increase her likelihood of getting a healthier fertility, and also getting a healthier baby. Then as you do that, of course, increase your water intake, and then start taking folic. But it would be good for us to write it for you. But in case you're far away from a doctor, folic acid is a supplement that you can get from any pharmacy, or any, even a beauty shop that has those supplements. Get yourself on folic acid. Then get to us, see us before you conceive, because we, at this age, you're likely to, if you don't have not been eating well and doing all that, can have any issue with your cardiac system, that is high blood pressure, maybe a cardiac disease that we have not noticed, too much fat, unhealthy fats in the body, which we can test and manage before you get pregnant. And then, of course, look for diabetes. This is the age where we have to look for all these things and manage them accordingly. Any infection, we treat it. In the meantime, we tell you to try. And as we are ready, we tell you to stop using this contraceptive, and then try for your pregnancy. In case 6 months pass and you have not conceived, then we start helping you get to your best fertility that we can be able, which includes checking your egg reserve. Egg reserve tells us whether you're able to conceive or not. So those are the tests we can actually do. But we don't let you go for 1 year, because 1 year is too long. We could go into menopause anytime. So 6 months. Once we let you try for 6 months, it's not coming, we must be able to help you. Come back, then we help you through it. So there are many things, many factors, and it's individualized. So make sure to see a gynae very early. Yeah.
Right. Let's get to the second question. This one asks, my periods, okay, my periods are late now by 21 days, and it's worrying me. I did a pregnancy test twice and the results were negative. Please advise.
We don't know her age though. She's how old? No. Okay. Assuming we're in our reproductive age, being from the age of 15, 15 all the way to 35, 40. If you miss your period for more than 21 days, it's good to test for the pregnancy. Since hers was negative, then there could be another reason why she's not having her period. It can be ranging from an ovarian factor to, these things like polycystic. I don't know how old she is, but it could be anything along that pathway that has prevented her from having her period. Even pills, certain treatments, how her diet is, change in environment, extreme exercise, extreme stress can lead to a no period. It means she did not ovulate for one reason or another. The other thing now, if she is perimenopausal, it is possible to lose your period. And if she's going, above 40, anything above 40, if you're losing your period, you can get irregular periods. So maybe you miss this 21 days, it comes and then misses another 40 days. It's expected if it's at that age. And then if you're above 45 towards 50, it's possible you're going into menopause. So if you are that age, don't panic. Just let it, count the number of months that you've missed your period. As long as it's more than 12 months, then you are in menopause. Yeah.
Okay. Thank you. This one says, thank you so much for the discussion on menopause. Doctors don't seem to discuss this much, and many women, myself included, are going through this period and have a really difficult time as we don't know whether we're really sick or it's menopause or symptoms. So this one is saying thank you.
You're welcome.
And they also ask, could extreme fatigue and dizziness be part of the symptoms of menopause?
It could be, yeah. It could be. It's important to rule out other things that can cause the fatigue and dizziness, like anemia, things like heart disease, things like diabetes, things like any chronic condition can cause that.
Okay.
If you have fever, then there's also possibility of an infection. But without all these things, then, and you have that age and you're going through hot flashes, mental distress, that thing can give you fatigue. Even depression depression can even be seen in physical, not necessarily because you feel like there's depression here. Sometimes it does not manifest that way. Sometimes it could be in the body where you cannot wake up in the morning, your bones are heavier, you cannot carry them, that can also lead to extreme fatigue, extreme disillusionment, and also that feeling of dizziness. Yeah, so it would be important to still rule out other problems before we can say it is menopause, but it is also a possibility that it could be menopause.
Okay. Okay. All right. So let me get to the other questions. This one says, please speak about cervicitis, or is it
Cervicitis.
That's it?
Yes.
I am not sexually active, but I have PCOS. I was told that maybe the blood brought about the infection, yet to be put on medication as I was on other antibiotics due to a cough and a bad flu treatment.
Okay. Cervicitis and PCOS are different. Cervicitis is an infection on the cervix causing it could present as discharge, or it could present as pain in the lower abdomen, or it could also present as pain while you're having intercourse. So that cervicitis can come from anywhere. It can be an infection that has come from outwards going in, either because it's important that she's mentioned that she's not been active, but even if you are active even before, some of this infection can remain and present even later on, such as chlamydia, gonorrhea, and other bacteria, but those are the most common ones that cause cervicitis. It's usually diagnosed by a doctor, so it would be very rare for a patient to say, I have cervicitis, without necessarily having the doctor review them. So cervicitis is treatable. It may or may not be related to PCOS in her situation, but it is very treatable. That one we can be able to manage with medication. With her PCOS, the treatment that she's probably getting is, if she's on medication, something to balance her sugars. So we use some medication to balance the sugars. There are many different types, so I might not be able to mention them on air. Or plus, she could also be having some supplements which help in managing how the eggs are being produced in the ovaries. And so for some, might be on combined pills, depending on the situation. And some might be even on treatment for fertility. So all these things are affecting the uterus. They're affecting the hormones. They're causing a lot of distress. Sometimes even discharge can come because of stress. Even itching itching, vaginal itching can come because of extreme stress. So it just manifests as physical itching. So it would be good to have an actual diagnosis of the cervicitis, and it is treatable. If there is cervicitis, it is treatable as PCOS is being managed with other things.
Okay.
Yeah.
All right. Thank you. I'm 55 years old and my period stopped last year in February. I still have serious hot flashes, which leave me drenched in sweat, and it becomes very embarrassing, especially when I am around people. When can I expect this to end? I also started getting this ringing noise in my ears, which is really irritating. Is this normal? Will it end?
Okay, so these symptoms, and that's why I think it's good that we're talking about this.
Yeah.
This particular symptom of hot flashes, it's very common. That's the first thing. And I think most people should understand that when a lady of a certain age is uncomfortable or is having some issues with how they're there, but someone is sweating, just be kind. Just be very kind because they're going through a lot. So I understand her when she says, I'm around people, I'm drenched.
Yeah.
You can't even wear clothes and they're full of sweat suddenly for a good 4 minutes, 5 minutes, So this sweating will end eventually. It's not there forever. And there's some people during when it's going into post-menopause, those symptoms might last a little longer than others. But for most, by the time you're fully in menopause, post-menopause. Now, when that 12 months is, and you're in post-menopause, they completely go away for some. But for a few, it remains up to a few years after, but they're not to that level of the one the beginning of the hot flashes. So it's only gonna get better. It's gonna get better. If you feel like these hot flashes are affecting how you're interacting with people, then we can treat you. If you feel like that's extreme, we can be able to manage you. So don't be afraid to come to the doctor because you're going through menopause.
Okay.
Yeah.
She mentioned the ringing in the ears.
Yes.
Is that related?
It may not be related to the gynecology part, but the ringing might be important for an ENT to review and see what exactly is causing that, because it could be completely unrelated.
Okay.
Yeah.
All right. Okay, this one says, Sharon and Dr. I am off topic, but please answer me. Can a uterus? You're not off the topic, actually. You're very much in the topic because we gave an opportunity for you to ask any question that a gynecologist and an obs could answer. So, Kosawa, can a uterus be transplanted?
That's a good thing. I had a TikTok once where I was asking people, we are learning about uterine transplants in school, and everybody's just coming with vaginal discharge every day.
Yeah.
So we want this kind of
Questions.
and novel questions, which is good. Thank you so much for that question. We have had a few transplants all over the world. Not all over the world, particularly in the Western world. Most would fail, but only one that I'm sure of that actually even delivered a baby. But it's not an easy organ to transplant because it's very complex, has a lot of blood vessels, a lot of nerves, because you can imagine contractions and all those things rely on nerves and blood supply to that organ. So being able to have a uterus, and the reason being, of course, I believe it's to be able to conceive. It's a lot of nitty-gritties that goes into it. That is why it has been difficult to have an actual, very successful uterine transplant. But yes, we are working on it, and we hope we can be able to get a good, one day, we should be able to get there.
Okay.
Yeah.
All right. There you go. It was indeed a novel question.
Yes, it's a very interesting question.
I also thought,
well, yeah, if you can
it actually
transplant a
happen?
liver, why
Yeah.
can't you transplant a uterus? It's a very good question.
It is.
It's only the functionality of this
Sure.
uterus is very critical, and it needs to have everything well done so that we can be able to, you see, this is another human living being that will grow in there. It's a very complex organ. It looks simple, but it's very complex, but we are working on it. And you see, there's hope. There's one particular one that was successful.
Okay. Thank you so much for the topic. This one says, I have suffered this year, the itching and hot flashes. So this is it. Oh, my
Yeah, it's
question.
self-diagnosable.
Yeah.
I hope
Okay.
that was correct.
Right. So
Yes.
this is it. Okay. My question is, how long will I go through this? How will I know that I am um, in menopause? Because I had fibroid, I think they meant to say, and my uterus was removed in 2018. I am 47 years now.
Okay, so the uterus was removed
Yeah.
and she's 47.
Yes.
That's a, that's a very, those are good questions, because how will you know you're in menopause if your period stopped when you had your uterus removed?
Right.
You know, the
Yeah.
the thing is, you will not know that you're in menopause for sure, but the symptoms of perimenopause, you'll still experience them unless your ovaries were removed. Because as long as the ovaries are there, they're the ones that control the whole system. They're the ones that give you a period. But without a uterus, we are removing the period factor. But if you have those symptoms, perimenopausal symptoms, the hot flashes, the what, you already know you are at the stage where you should be getting into menopause. So expect the symptoms only, but not necessarily the period at all. Yeah. So, because the reason why we talk about this is because of the period is important, but just the symptoms on their own, you don't need to know that you've gotten into menopause. You get what I mean? Yeah. The symptoms will tell you that you are heading to menopause, but you might not be able to tell exactly when you went to menopause because you didn't have periods that can signify that
Yeah.
your periods are over now. Yeah.
Right.
So it's just to take the symptoms as they come. Let's help you with the severest of them all, and then once they go away, just know that the menopause has come in. Unless you want to confirm, which does not really change much. Yeah.
Okay.
Confirmation is we come, ask you questions, and then do the tests, which are just not diagnose. They don't diagnose, but they give us direction. Yeah.
Okay. She also asked, how long will this last?
Yeah, we're counting perimenopause, which can last from 40 to 45 years. Menopause can enter anywhere between 45 to 50. So those are 10 good years of something happening. And then after 50, most of them will resolve.
Okay.
Yeah.
All right. There you go. This one says, I have really. Okay. Thank you for this topic. I have really waited for it. Oh, sure. And I am already being enlightened. Karibu. I
Thank
am
you.
a 45-year-old mother of two. I am experiencing a few of the telltale signs after 4 years average postmenopause. Okay, after the 4 year average postmenopause period, Dr. says things get back to normal. Does that mean even the estrogen levels rise again as before menopause?
Okay, so the estrogen does not go back because it doesn't have an egg to produce it. So the estrogen remains low. It's only that your body now acclimatizes to the new change. Yeah, because it's a new thing. When at the beginning of menopause, it's new to it. It had estrogen all the time, but now the estrogen has gone away. So within that transition period is when you go kind of like the body's just telling you, what's happening. Then later on it gets used to it, and then you kind of like go back to what feels normal. Yeah.
Okay. All right. There you go. Dr. Mine is. Oh, no, it's not. It's not a silly question. You say, bear with me, please. So I turned 46 in December, and I'm just wondering if I start experiencing menopause, it means I can not have children or?
Yes, if you go into full menopause, the reason you cannot conceive is full menopause. Perimenopause, it's possible. I want to make it clear. It's still not impossible. There are people who get pregnant at 43, 44. I've had a 46-year-old because they were still having their period. As long as you have your period, you still have an ovulation. there's a chance you could be ovulating. And especially if you have a regular period. If you have a irregular period, you might ovulate this time, you might not ovulate the next time. But if you're in full menopause, no period at all, then you will not, there's no egg. So it means you cannot be fertile at that point. Yeah. Very rarely that people get when they're amenorrheic. Like amenorrheic, no period at all. Very, very rare. Yeah.
Okay. Those miracle babies.
Yeah.
My friend is 49, his wife is 48. Last 3 years, it has been stressful for them in the bedroom. Does that mean they need to see a gynae? Because marriage is collapsing, yet their daughters in okay, yet they are daughters-in-law. Okay, I'm not sure what they mean, and their friction isn't good.
Okay.
Okay.
Things get tough, really, with the changes that occur at this age between 40 and 50 because of these changes. More so is when this time when you're having all these problems and a lot of social problems, they all add up to lower libido. But it's good to mention on the other side that there are others who get high libido, very, very high. So we can see those guys who are listening and like, no, me, I'm opposite. It's very possible. But now, if you have itching, you have pain while having intercourse, you have dryness, and your partner is still very active, it becomes a bit of a problem. And they might not understand why you're not into it as you used to. And that's why they need to have a conversation. Now, because they're empowered, knowing that this is a natural process that goes on but gets better, it's good to have a candid discussion with your partner. Just let them know this is what you're going through. You're having hot flashes. Even you get upset very fast.
Yeah.
You get anxious. You can get low moods. You can get very high moods. You can change anytime. He needs to understand this, or even let him watch this video on Facebook, because it will really, really help them understand what their wives are going through at this stage. Then also the psychological bit, which is when the partner is not interested in the wife, because now she's not interested in him, and then things are not good at all. It needs it might need a third party being a counselor, particularly in these matters, not just any, a particular psychologist or a therapist who can be able to understand where both of them are coming from, because all of them have different needs, and these needs are haywire. They're all over the place. They need to have a third party to be able to listen to both of their sides, both without judgment, and help them come to a place where they have almost equal compromise, where they can work together. Because relationships at this point, this is the time they have the hardest. This is where you prove your realness and your real, it's love, but there's also other things. Yes, exactly. So I would advise them to show their partner this video, let them understand, or just let them see a third party.
Okay. All right. Now, if a lady has periods at the age of 54, does that mean she can still conceive?
Yes, if you have a period, you're producing an egg. If you're having but if you had stopped having your periods and you have bleeding after that, let's say you knew you were in menopause and then you have sudden vaginal bleeding, it would be important for you to come back. You know why? Because it's not a period. It might be something else. Yeah. So don't ignore what looks like a period after your period stopped over 12 months. Just come back, because that's not, we need to review you better. Unless we put you on medication. You remember the estrogen? The estrogen medication, it may give you some level of bleeding, but let us be the ones managing you if you're bleeding after the 12 months of no period.
Okay.
Yeah.
All right. Thank you, Dr. Ari. What happens to women who give birth after 50? I'm not sure what they mean by what happens to them.
I think I understand.
You understand?
Yes,
Then, secondly, can one conceive when they have hormonal replacement therapy?
Okay. So the first one, let me talk about the first one, the giving birth after 50. What happens is that the body will just take care of the baby, and you will give birth, ideally normally. Even Sarah in the Bible,
Right.
she was in her 90s and she gave birth. But I will not ignore the fact that with this, also our time and our generation, there's a lot of other things that go on at that age: hypertension, blood sugar, all those things, all those lifestyle things. So those things might be a factor when you are pregnant at an let's say a later age. So you are more at risk of developing preeclampsia. You're more at risk of getting diabetes, but not everybody does. So I want to make it clear. Don't be
Yeah.
afraid if you're already pregnant that you're going to get. You might not necessarily get, but you're at risk. So if we follow you up from the beginning, we can do this journey together so that we can get a healthy you and a healthy baby at the end of it all. Yeah, but giving birth should still be the usual. If you have no indication for a cesarean section, you will still give birth vaginally. Yeah.
Okay, and then
And the baby, yes, and the baby, before I go to the HRT, the baby will also, most of the time, they will come out healthy. Okay. But there's also that small chance of, because of the level of that egg, what do I say? The quality, we say the quality of the eggs,
yeah.
might not be 100%. There's a low chance, okay, not, but there's a chance of getting Down syndrome and other problems with the baby. But as we work with you, we investigate for those things even before you get to the end of the pregnancy.
All right.
Yeah. For the HRT, this time when we're giving you estrogen, it does not return your eggs. It does not return your eggs. It's just to relieve the symptoms. So if we are on estrogen, then it does not necessarily give you back your fertility.
Okay.
Yeah.
All right. At around 48, I started the process of menopause. I am now 52, with around 3 years of being in that menopause season. I thank God I didn't experience the much side effects already mentioned, but my worry is my weight. I am 107 kgs. How can I manage my weight?
Okay. Well, it's a very, very important question. And weight has been a discussion for years on what really is good for you, good for this person. And it's very, very individualized as well.
Right.
But there are general factors that I would mention that I know you might know, but maybe with a different perspective. Being overweight, not everybody who's overweight is unhealthy. Let me start from there. We say that it gives you a possibility or a risk to develop other things other than as compared to other people. It could be familial, but you don't want to also blame on genetics, because in the same family you can still have twins. One is obese, the other one is underweight. It's very possible. Most of the time they will look the same, either underweight, same weight, good weight, or on the overweight side. So it is the things around you that you can change.
Right.
First of all is to love yourself the way you are first. And it's okay. Love it, because who else will love you?
Right.
You're okay. You're good. Then you change the things that you want to change. It starts all from the mind. And I know it's usually when we say we're doing diets and all those things, I don't recommend any diet except the fact that I talk about plant-based a lot, because I believe in the power of plants and eating antioxidant foods, right? So if someone can decide that at least I want to lose, even just take it like a small bit. You don't have to lose up to 80 kgs. Decide your goal this month is just 2 kgs. Only 2 kgs. It's going to be tough, but it's possible to lose that weight. So it starts from the mind. And when you decide that every time you have a meal, because even a big girl still needs to eat, right? I got that from a movie. And still got to eat. You still got to eat. It's still healthy.
Right.
So every time you have a meal, because we want you to have a meal at least 3 times or even 5 times in a day. 5 times being you have your 3 meals, morning, breakfast, and dinner, and have breaks in between. The breaks can be simple things like carrot or one piece of apple, or
Cucumber.
yeah, or a cucumber. Make them healthier options.
Mm.
You don't have to eat one carrot because maybe that one carrot will still make you feel hungry.
Right.
You know,
Yeah.
for the in-betweeners.
Mm.
Yeah, the in-betweeners can be some, just pick something healthy rather than the biscuit or the mandazi or whatever, you know, and then take water during that time, or take with a vegetable like a kachumbari.
Mm.
You know, kachumbari is also a good meal because it has the vegetables part, and it's still healthy and does not add any fat or does not add carbohydrates. Yeah. Then when you're eating your full meals, your breakfast, the people will eat like the opposite. They will eat
Yeah.
less, yeah,
Less breakfast and more dinner.
yeah, and more dinner. And
Mm.
it works for them because everyone is different, and that's okay. But I recommend that every time you eat your breakfast, look at it. Does it have the vitamins? Because it's about the vegetables. Eat the vegetables more, and then have like an egg if you eat any animal products, an egg, and then even a kachumbari is good, and then your tea. Choose if you're going to have black, or if you're going to have, because at that point you're looking at the number of carbs that you're eating. If you're eating tea, you're taking tea with milk, it already has carbs, so it will be supplemented with with one egg and vegetables. That's just a simple breakfast for anybody who wants to lose weight. The tea already has carbs, and that's fine, but eat a lot of the vegetables. Kama unajua uko na njaa, eat the vegetables. Lunchtime, have that full meal, and that's okay, whichever it is. Just make sure your vegetables are more so that you get fuller, and then your carbohydrates are just filling your palm, that part of the palm.
Yeah.
Not leave the fingers part, that round part of your palm. That part, eat. But now the vegetables eat more so that you fill your stomach. Put a bit of proteins as well. And then dinner, if you're still hungry, add the vegetables. Again, it's about the vegetables. If you can add the vegetables, eat less of the carbs, and then increase. I mean, your in-betweeners are also healthier versions. And then do 20 minutes of any workout, skipping rope, especially if you're heavy, your knees can hurt if you're running. So if you're a swimmer, you can swim. If you skipping rope is also good. Do those skipping ropes, increase them up to 100 every day to 500, and then stick there. So it can't be. I know it's not easy, but if you just follow even that, whatever I've said, and your goal is just 1 kg every month, by the end of the year you'll have lost 12 kgs.
12.
And be disciplined and consistent. That's the only way, because you can't think yourself into losing weight just sitting and watching TV, or assuming that what you eat will just go away. We have to be intentional. Be
Right.
intentional in what you do.
Okay.
Yeah, I understand her. We all go through the same things.
Yeah. Okay. I'm 55. Last month I had very heavy periods, which I had not had for months. Can I conceive at this age because I don't use anything? Okay. Yeah, sure.
She's 65 with
Five
periods,
five. Five
or
five.
55 with periods.
But she says she had it last month, very, very heavy, but she had missed it for months. She didn't say how many months before.
Okay.
Yeah.
Okay. If it's possible she could be in perimenopause, because we're not yet at menopause if you're having, unless if it's more than 12 months and you're having a period, you need to see a doctor. Let's find out what's causing it. It could even be a fibroid that's causing the bleeding.
Okay.
So let us, if it's more than 12 months.
Okay.
If it's 3 months and then suddenly you have these heavy menses on their own warrants you to come back to
Okay.
the doctor. If it's a normal period, then you can observe and see whether it goes away again within 12 months. If she has, it's basically the heavy menses. If they're heavy, like for her, I would recommend let her see a doctor first, so that would rule out other things.
Okay.
Yeah.
And speaking of heavy menstrual periods, this one says I'm 47, and early this year I had heavy menstrual periods, which with blood clots, and it was lasting up to 17 days. It was horrible, but by God's grace, it has come back to normal. Is this a symptom of menopause?
It could be. It could be. Um, but we don't want to. I would want to rule out other things as a heavy period.
Okay.
Things like even some medication that we give to our patients can increase the period even once, like a blood thinner, or maybe there was something that could have happened at that point. But if it's gone back to normal, that's okay. But it would be important not to ignore the fact that, but heavy period can be just the beginning of the reduction of your periods. Yeah, so she can either observe if she's okay now, but if it gets there again, she
Yeah.
needs to see a doctor.
Okay.
Yeah.
All right. Thank you. Now this one says oh, okay. Why are my hot flashes so severe at night, and at the same time I experience pain on my feet? I'm 57 now.
Okay, so what happens with night? It's like our bodies are usually more sensitive to pain, to symptoms that you would have during the day, but you feel them more at night. Probably because of that restful nature, and then your body is now just showing you there's a problem right here. If you have a fever, compare a fever during the day and a fever at night. Very bad at night.
Right.
If you have bone pain during the day and
Gets
at
worse
night,
at
it
night.
gets worse at night.
Yeah.
So any symptom of anything usually is more augmented at night. So if it's affecting her, especially when you're sleeping, it would be good to see us. Even the pains in the legs could also be related, because these hot flashes, when they come, they're not just a normal heat like you feel. It causes some level of irritation to the body, which includes tingling sensation. Yeah, so she needs to see a gynae to be able to help with that. And also the other things that cause pain in the leg, diabetes, the same things.
Yeah.
So she needs to have hers checked.
Okay. All right. Thank you. Now I will be 26 next year. For about three years, my periods are not regular. I get them sometime after 3 months. Sometimes I can get them 2 consecutive months, then they disappear. When they come, it takes 5 to 7 days. Normal flow. It used to be heavy, but now it's not normal. Am I normal? She asks. And also, I have been on anticonvulsants since I was 4. Please advise.
Yeah. Ideally, we should be getting periods cyclically, like after every couple of number of days. There should be some level of prediction on when you get your period. So yours might be 21, mine might be 35, and there's an average of 28 right in the middle. But at least that does not have to come every month, but it can come one in after every one in, let's say, in a week.
Okay.
So after every 5 weeks, which means you have a longer period before you get your periods. So, but hers seems to be coming at times when it's not easy to predict. Yeah, so she might need to. It's not normal not to have. You should have at least a predictable period. So she would really benefit from having a scan and a doctor's review to find out if there's another issue that is causing hers to be that way. The anticonvulsants don't necessarily change much of your period, but they are drugs that are cleared by the kidneys, but they are cleared in the body somehow by the liver, which also metabolizes some of these hormones. So we would like to take a full history from her and be able to see whether they are working together in a way that's causing her issue at the
Okay.
moment.
Okay.
Yeah.
So it's important for her to see a guy.
Yes.
Okay. There you go. This one says, I am okay. Hi, Dr. All what you have said, I am going through. I'm 43, and I need mtoto. My periods are on and off. Kuna uwezekano? I have tried for 5 years now. And now that you say menopause is not a disease, can one come out of menopause without any medication?
Yes, yes, yes. That's very true. Very, very true. It's possible that most people will not need medication. just a few will need HRT treatment, and a good number of the ones who don't take the HRT will be on supplements only.
Okay.
And they'll be fine because it ends at some point. For her issue, being at between the age of 40 and 45, there's that time when you have your egg reserve, which is a little bit on the lower side as compared to when you are below 35 years of age.
Yeah.
So it is a bit more difficult to conceive when we don't have a regular period or we do not know when you're ovulating. It's possible for some to just not expect a baby and get. But there are those ones who also have difficulty. It's good for her to have a medical check. We would check her egg reserve, see whether there's a possibility of conceiving, and if there is, we can be able to help her. But it's not the end of the road. Let's just review. It's very individualized treatment. So even when I say something, it does not mean that it affects everyone.
Right.
I know the symptoms are all the same,
Yeah.
but it's very individual. You can still be able to conceive, but it's not at the same percentage as if you're under 35.
Okay.
Yeah. And if you've been trying for 5 years, we say at this age, even if you try for 6 months and it's not coming, come, let's help you.
Okay.
Yeah.
All right. Thank you. Now, there's a 49-year-old one here who says, how do I overcome this rudeness and anger every now and then and like seeing everyone is against you? Is this what you talked
Yes,
about?
that's what I was talking about. Your moods
Yeah.
swing from the
Oh.
other side to the other side of Africa. It's very possible. And it's a very good thing to know that you have an issue and it's okay because your hormones are doing everything for you at this point. And if you also had underlying issues, those issues can even be exaggerated at this point.
Okay.
Things like that anger, you are upset with everyone, and even the feeling of other people being against you. And you know what? People don't wake up in the morning to want to be against anybody.
Yeah.
They have so many things that they have within themselves, including issues like the ones you have, that they might not necessarily have something against you. But I know it's possible to have that feeling.
Yeah.
Yeah. But it's possible to go through this with a psychologist who can be able to listen to you, go to the root of the problem, and help you through this. It's okay to look for help. Get someone who will understand you.
Right.
It doesn't have to be your family member. Even yourself, just walk to a place with a psychologist to say, I need help. I feel like this, I cannot do without someone else listening.
Okay.
And pray. If you pray to God.
Right.
He will help you through. Even when you ask help, please help me on this thing, they will help you. Because it's very possible to get out of it, but only with help.
Okay. Hey, Doc, our questions are so many. There are so many. And unfortunately, our time is gone.
Yes.
So this is where we finish it at. But thank you for coming.
Thank you, Sharon.
Most welcome.
Yes.
And we look forward to the next session with you.
Me too.
My people, I'm so sorry for all the questions that we've not been able to answer, but I really do appreciate that you tuned in and that you sent that message on 20933. We hope that sometime, tutapanga na doc, tuone how we can, next time if we can try and start where we left it at today. But thank you truly for your time. May God bless you so much. I hope to see you tomorrow again here because it's going to be amazing. The lady that I'll be hosting has an amazing testimony of God's victory over her life. So join me then and your life will never be the same again. My time is gone. I'll see you tomorrow. Up next is Wangoi with the latest in the news world, and then Amani Aila on Shangilia. My name is Sharon Naitore Wankenye.